Welcome on today's conversation on the future of work, where AI isn't just a buzzword, but a business driver. This is Lenovo Work Reborn, live in Orlando. Hey, Justin, welcome to the Work Reborn podcast. How are you doing today?
Fantastic. Thanks for having me on.
Thank you for coming on. Justin, tell us a little bit about who you are at Lenovo and what you do.
Sure. So I'm Justin Collier. I am a dual-boarded physician. Most of my career, though, has been in the field of clinical informatics. And so I'm very excited to serve as the healthcare CTO for North America at Lenovo.
That is really cool, Justin. How did you get into this type of work?
The long version or the short version? I'll give you the short version.
All right.
All right. So when I went into practice, I had the whiplash sensation of going from having a lot of electronic tools and technology to being at a hospital that was still based on paper. So they did not have electronic health records. They didn't have a lot of the modern tools that I had gotten used to. And I complained a lot. And as happens from time to time, people hear those complaints and they say, okay, fine, it's time to pilot those things you're talking about.
Yeah.
So you have to help lead it since you're complaining a lot. So luckily that went really well.
Okay.
Went really well. And they said, hey, we need to do a bunch more of this. Can you come work with us part-time to do more of these kinds of implementations and maybe do some other technology things? And I said, I guess I could do that. That would be a bigger scope of impact than I would otherwise have. And so I did that, and it lasted for about 5 months. And they said, we need all of your time because we want to do a whole bunch more with technology. What do you think? And so I became a division CMIO at the health system where I was working and did that for a lot of years. And then later I had the chance to go to a global systems integrator to do healthcare and life sciences for more than one health system at a time. And so I did that for a number of years. And now I come to Lenovo to help a lot of health systems all across the country to get better all at the same time.
I think it's so amazing that we have you on because I've been talking to guests and leaders who say they don't want a one-size-fits-all solution depending on the vertical that they're in. They want something that makes sense and is personalized for them.
Right.
Healthcare is really one of those things. There's so much governance and there's so much risk when it comes to this vertical. And, you know, there's a lot that goes on behind the scenes.
Absolutely. Yeah, lives are on the line every day.
Well, let's kind of change the vibe up of the conversation. As we know, we have a partnership with FIFA. And I thought before we get like really deep into the talk, we start with an icebreaker a little bit. Does that sound good?
Sure.
Okay, cool. So FIFA is all about fan engagement. It's a sport, right? And I also think transferably in the workplace, employee engagement is so important. So what does employee engagement mean to you when you think about the future of IT support?
Okay, so the future of IT support, of course, in a health system, you really have two different kinds of workforce.
Right.
So you have the clinical workforce, but then you also have the traditional workforce that does so much of the work behind the scenes. Being able to have solutions that are tailored to each of their needs is super important. And I would say, too, that the best IT support starts by preventing as much IT support as you can up front. So that means selecting great tools, great technologies that have incredible resilience, incredible reliability, and incredible performance. So you want to make that employee's experience as good as it can be with their day-to-day work as they're using your tools, and have tools that don't break, right? So the best
they kind of need to work, right?
Especially when, you know, seconds matter and lives are on the line. So that's a really important part of what we provide to the health system customers that we're blessed to serve.
I love that answer. That is so well done. I can't add anything else to that. That was exceptional. Let's dive deeper into that, though. When you look at today's workplace, AI, hybrid work, rising security risks, it feels like IT leaders really are under constant pressure. In addition to the normal pressures of lives being on the line in the healthcare scenario, right?
Of course.
So from your perspective, why does Lenovo believe this is the moment to rethink how technology supports people and not just the systems?
Absolutely. So in healthcare, we have a number of different crises that are going on all at the same time. One of the big crises that we're under threat from, of course, is burnout. Our clinicians, our nurses, our physicians, clinicians of all types really, have a tremendous epidemic nationally and really globally of burnout. They're having to work so hard and they're so mission driven that they work themselves to that point where they're just
Right.
absolutely burned out. So being able to provide them with tools that make their life more efficient, that make their life better as they go through their workflow, tremendously powerful in terms of being able to fight that. At the same time, we have tremendous clinician shortages, especially of specialists. And it's so bad globally and in the US in particular that we can't train our way out of that problem.
Right.
We will never be able to train enough to catch up with demand for most of the specialties. It takes, on average, 60 to 90 days for people to be seen on an outpatient basis at a specialist office. And a lot of those patients, unfortunately, end up in the hospital in crisis because they weren't able to be seen soon
Right.
enough. So being able to, again, make their work more efficient, improve patient access, improve all of those things to make the throughput better so that they could be seen more rapidly, so that some of those empty jobs may be filled by AI someday. For example, it's really, really important work to be done. And of course, healthcare is the number one most targeted by cybersecurity
I didn't even think
threats,
about that
right?
actually.
It's absolutely criminal, literally.
Literally.
Um, but
Dun-dun. Yeah. But it's true. Yeah.
but it's a threat to life crime.
Yeah.
Right. If your credit card gets stolen, if your bank is closed for a couple of days, it's probably not a life-threatening thing. But if a hospital goes,
That's serious.
if a hospital gets hit, it's absolutely tragic, and
Yeah.
it can have real-world implications that count up in lives.
I never even realized, based on all these conversations that I've been having, how crucial IT is within healthcare until we had this conversation just
It's the
now.
underpinning of everything that we do in healthcare these days. But it also is a tool that has so much potential to really transform the way that care is delivered. We're working with all of our customers to try to help them achieve those improvements.
What do you think is the most positive outcome of us being able to support healthcare organizations?
I would say even one life is priceless,
Yeah.
right? So just being able to make that kind of difference, or helping a clinician to get home 1 hour sooner so they can spend time with their families. All of those are just such absolutely priceless gifts, such great rewards for the work that we get to do. It's super meaningful. It drives our whole team all the time.
I'm fired up, man, after this conversation. I underestimated the value of what we do in this specific vertical. I always understood
For
that it's
sure.
important and it's helpful, but the way you bring your expertise into this conversation has really shined a new light on it for me.
Yeah, so we help with the day-to-day, sure, the end-user computing devices, the workstations, all of those things that people use in their day-to-day. But we also help with the high-performance computing and the AI and the things that are behind the scenes that are making that next drug discovery or finding that new cure. So it's super impactful.
What does Work Reborn mean to you?
Oh gosh, Work Reborn. It is bringing back a joy of practicing medicine to those that practice it every day.
Well said, Justin. If I had
So I dropped the mic,
if I
but
dropped
it's
the, yeah,
attached.
but like that was epic. Thank you so much for being on the show
Thanks so much.
today. If anyone is interested in learning more about the Work Reborn report, make sure you check it out. Download it in the description below. Or if you're watching us on YouTube, QR code on the screen here. Make sure to scan it and download your copy. This has been Work Reborn, and thank you so much for being on the show.
Thanks for having me.
Thanks for joining us live in Orlando for this amazing episode of Work Reborn. I've been your host, Rita Risha, and it's been a pleasure to bring you insightful conversations from around the world, especially at this event, on how we are bringing new life to the modern workplace. If you enjoyed this episode and you want to stay tuned on more ways that we are doing just that, make sure to like, follow, and subscribe our channel, and download a copy of the Work Reborn report today.
Lenovo.